The risk of famine in Gaza is increasing by the day. The grim assessment of a new UN-backed report that says almost the entire population is facing a hunger crisis. The warning comes with the UN Security Council expected to vote later on a draft resolution that focuses on the urgency of allowing much-needed aid to enter Gaza, a resolution that the U.S. says it is ready to support after days of delay in New York. And with starvation now at catastrophic levels, supplies of food, water and medicine cannot come soon enough for the people of Gaza.
Signs of starvation are not hard to find in Gaza. Here in Rafah, crowds jostle for what little food is available. The despair is evident.
This war brought an unbearable level of humiliation. We struggle so much just to provide lunch. Life has become so expensive. We do not eat, drink or sleep properly, and nothing is available.
A United Nations-backed report says more than 90% of people in Gaza are facing crisis levels of hunger. A critical situation amid Israel's relentless bombardment in response to the October 7th Hamas terror attacks. UN agencies say Gazans are getting just 10% of the food deliveries they would usually receive. People struggle to find water, medicine and fuel.
What is happening in Gaza is unprecedented, both in terms of its scale, but also how quickly it is happening. You know, in the world right now, there are about 130,000 people who are in catastrophic levels of hunger, meaning they're starving. In Gaza, more than 500,000. That is 4 times more. And that is what makes this totally unprecedented.
Israel did briefly allow aid through its Kerem Shalom crossing into Gaza this week, but an Israeli airstrike that hit the Palestinian side forced UN staff to stop its pickups there.
We can still avoid this famine, but we need to make sure that people have food, people have water, they have shelter, they have sanitation. And for all of those things to happen, we need border crossings open so these commodities can come in.
The growing desperation for food also means that the limited supplies that do make it into Gaza are often seized upon before being handed out. And the UN says it's not just access to aid that is vital, but also its safe distribution across the Strip. Without it, they warn the risk of famine in Gaza is increasing every day.
Let's bring in Tarik Jasarevic. He's a spokesperson for the World Health Organization, one of the agencies involved in putting together this report. Tarik, good to have you with us on DW. Now, this report paints a very grim picture. Just how unprecedented is the speed and scale of this hunger crisis unfolding in Gaza?
Well, what is really incredible is how fast we got into this situation that people do not have enough to eat. It's just really in a matter of weeks because Gaza is under sort of a siege where what gets in is nowhere enough of what people in Gaza normally would have. So in this quasi-siege situation, we are getting to the situation and we have been just hearing from our colleagues on the ground who are trying to bring medical supplies to hospitals, and what they were saying that people would come to trucks thinking that and hoping that there is a food in those trucks, and then our colleagues would say, no, it's medical supplies, but everyone is desperate. And even in the hospitals, our colleagues were saying that all patients would just ask, do you have some food for us? Yeah. So really, the how fast we got into this situation of food crisis that would obviously bring more more suffering due to illnesses, because the combination of malnutrition and infectious diseases being spread is lethal.
Yeah. Tarik, the U.S. says it's now ready to back a draft resolution at the UN to help allow the delivery of more aid into Gaza. In reality, is that going to make much of a difference on the ground?
What we need is a ceasefire. Ceasefire is the only solution, because as long as people are being bombed, there will be more casualties, there will be wounded people, there will be dead people, wounded people who cannot get treatment because there's less and less of health facility capacity in Gaza. Just bringing medical supplies will not make hospitals function, because these hospitals need access, first of all, safety to operate. They need also fuel, food, clean water. They need specialized stuff that is no longer there. So really, ceasefire first, and then continuous and unhindered access for all humanitarian goods without exception.
As long as the fighting continues, what options are left for Gazans to stay healthy?
There are very little options. Can you imagine 50,000 pregnant women in Gaza, more than 300,000 people with chronic diseases, and increased spread of respiratory viruses, of waterborne viruses, of skin infections, simply because there is no water, because clean water, because there is no hygiene, there is no sanitation. So with every day we see bombardment and we see this siege continuing, and more lives will be lost. Really, the only solution is stop this suffering of people of Gaza by ending hostilities.
That's Tarik Jasarevic of the WHO. Many thanks.